Well, good morning, everyone. I'd like to thank everyone that's joining us here today. Thank you very much to Premier Ford and Minister Jones for your work on this very important announcement. And a special thanks to Alex Munter and the whole team at CHEO for hosting us today and for your dedication to supporting children and youth and their families. We are all delighted to be here with you. Our government is putting children and youth first to ensure that they receive the care they need when they need it. We have and continue to make record investments to support thousands of children and youth with special needs and their families through programs and services that support early needs identification and child and family-centered rehabilitation services to help caregivers cope with their day-to-day challenges and to make access to services more coordinated, more efficient, and more likely to lead to better outcomes. We're also investing in modernized facilities across the province, including right here at CHEO, to increase and improve access to critical programs and services. Through collaboration with families and sector partners, we will continue to strengthen and improve services and supports for children and youth with special needs. Together, we will help more children and youth grow into thriving adults in communities right across our great province. Thank you very much once again for joining us. I'd now like to call on Alex Munter, President and Chief Executive Officer of CHEO, to say a few words.
Well, good morning, and it really is a great morning. Bienvenue à tous et à toutes. Quelle belle journée aujourd'hui ici à Ottawa. J'aimerais souligner, évidemment, CHEO operates on the unceded territory of the Algonquin Anishinaabe people, and we acknowledge their stewardship of this land. And I know in the room we have pediatric healthcare leaders from all corners of Ontario who share, I know I can speak for them all when they say there is much work to do in the spirit of reconciliation to knock down the barriers to care that still exist for Indigenous kids and their families. So I'm not going to scoop the Premier. He's making the announcement. It's probably tacky and maybe not that smart. But let me tell you, I want to explain to you the problem that we've all been working on together and that we're here to address. And I think the easiest way to think about it is that any healthcare organization, a hospital, a children's treatment center, mental health agency, a primary care clinic, think of it as a box. And the first thing that has to go into the box is the urgent and emergent care that cannot wait. So in our context, perhaps a child with a perforated appendix, a persistent headache that turns out to be a cancer diagnosis, a teen in mental health crisis, a teeny little baby that's not able to breathe because of a viral infection. And when the box is too small, the urgent and emergent care fills it up and pushes aside the planned and scheduled care, medical, surgical, mental health, development, rehabilitation, diagnostic imaging. And here at CHEO, for example, we have 36,000 kids waiting for an appointment, 2/3 of them waiting longer than is clinically recommended. And that affects them, and anybody who's had a sick child knows it affects the whole family. And missing crucial intervention windows for children can have very long-term and significant impacts. A population of kids has been growing, will continue to grow. There's going to be 750,000 more kids in Ontario in 20 years than there are today. And in the past 2 decades, we've seen the emergence of new diseases, and we've seen increase in prevalence in many diseases, diabetes, childhood cancer, many mental illnesses. We have more kids with developmental needs. So more kids, more needs, more complex needs. So what's the solution? Well, the solution is a bigger box. So physically, yes, and of course, and you heard Minister Parsa speak to some of the investments the Government of Ontario is making in terms of capital, and there's the exciting new Sick Kids in downtown Toronto, there's the Grandview Children's Treatment Centre in Durham, and out front here, the Integrated Treatment Centre for kids with special needs and mental health challenges, which Lisa, you first announced, and Minister Parsa, we had a chance to chat about the other week. So yes, we need physical capacity, but mostly we need service capacity. We need more healthcare workers on the job, in our clinics, in our hospitals, in our treatment centers, and mental health agencies. And not just more, not just bigger, but actually better. And what today's investment, presuming there's an investment, today's investment will do is unleash, Premier will unleash the creative forces of child and youth health organizations across the province. And there's so many examples. I have a list of examples which will make the event organizers queasy because it would take me too long to read them all. But, you know, there's using technology to deliver care at home, school, in rural and remote areas, like the Sick Kids Virtual Urgent Care. There's the need to knock down the silos between our organizations, Holland Bloorview and Safe Haven, creating a new residential facility for kids with medically complex needs. There's the need to plan and think across the continuum, which we've done together as a sector. When we invest in child and youth mental health services in the community, that prevents people from needing to come to hospital. When we invest in children's treatment centers and outpatient rehabilitation, we make it possible to catch up on surgical backlogs. It's all connected, and we're planning and thinking together. And here locally, and I see many, many partners from the Kids Come First Health team, where we're standing up whole new models of care here in Eastern Ontario, in home care, in one call, one click mental health for addictions, working with community physicians on childhood immunization, new urgent care clinics. So if this sounds familiar, Premier, it's because when you were here in October, I kind of talked your ear off about it. And then Minister Jones, I did the same when you came in November and gave you both a big package of documentation and data. And I know my colleagues in Hamilton and London and Toronto and elsewhere did the same. And Minister Parsa, you're newer to the conversation, but we did the same with you when you were here a few weeks ago. And so my main message today is thank you for listening. Thank you for listening. What you're going to hear about today will represent the single biggest expansion of pediatric healthcare capacity in the province of Ontario's history at one time. That's a big deal. And in the short term, permanently increasing the child and youth health system's capacity will make a world of difference for kids and their families this year, next year, the year after, and for every year to follow. But I want to leave you with this thought. I'm almost done. I want to leave you with this thought. Long after we're all gone from our current roles, this investment will still be paying dividends. And that's because investing in kids today means happier, healthier citizens, taxpayers, innovators, parents, community members tomorrow. And more than that, when we think about the future of the healthcare system in Ontario, 2 of every $3 in the healthcare system is spent on chronic disease management. And when we can put kids on the path to lifelong health, we prevent or delay the onset of chronic disease. We reduce the need for healthcare services later. So to the Premier, the ministers, the MPPs, when you leave here today, I would encourage you, I hope you leave with a tremendous sense of pride that what you have done here today, what we will do together as a sector, really will make a difference for decades to come. Thank you very much. And Minister Jones, I'll turn it over to you.
Thank you, Alex. You very well articulated the reason why we are here this morning. So good morning. It is great to be in Ottawa with Premier Ford and Minister Parsa, as well as MPPs, Lisa MacLeod, Goldie Gamara, Nolan Quinn, and Stefan Sarazan. Thank you to Alex Munter and the team here at CHEO for having us all here today for such an important announcement. I also want to take an opportunity to welcome and thank our partners from the Children's Health Coalition and our colleagues from Ontario's pediatric hospitals for being willing partners with our government. We all share a common goal to work together to improve health care for children and youth across Ontario. Our government is very grateful for the exceptional care provided by healthcare workers across the Ottawa region and our province, and for everything you do to support children and youth and families every single day. Through Your Health, the Plan for Connected and Convenient Care, we are ensuring children and families can access care easier, faster, and closer to home. This includes investing at record levels in our hospitals, clinics, and community partners to improve how they deliver pediatric care. We are continuing to build on the progress already made with today's incredible announcement. Our government will continue working to deliver more connected and convenient care to Ontarians where and when they need it, and provide people with a better healthcare experience both now and into the future. And now, may I say thank you, stay well, and I will pass it over to Premier Ford to open the box.
Well, thank you so much, and good morning, everyone, and thank you, Minister Jones. I have to tell you, Sylvia, you've done an incredible job in making sure that we continue growing our healthcare system, adding beds, adding frontline healthcare workers, and I'm very grateful for your leadership. And it's so great to be back in Ottawa. I tell everyone, every time I come to Ottawa, I have the best trip ever. I have, as I mentioned, just Minister Jones, Minister Parsa, and your local champions, and they truly are local champions. Lisa McLeod, that everyone knows, and Goldie Gamari, and Stefan Sarazan, and Nolan Quinn. Thank you for all the great work you do for the folks here in Ottawa and the surrounding region. I want to welcome Councillor Marty Carr as well, representing the City of Ottawa, and I want to acknowledge all the CEOs, our amazing partners, and folks, I got to tell you, we do have the best CEOs anywhere in the entire world, and I truly, truly believe that. They're real, as I always say, they're out-of-the-box thinkers, and from our hospitals and pediatric centers and healthcare organizations from right across this great province. We have an amazing turnout today, and I apologize if there's people I leave out, but we do have an amazing team, and thank you for joining us. But there is one person I do want to give a shout out to and talk about out-of-the-box thinker, and I've always mentioned that to you, Alex, for so long. It's Alex Munter, and our hometown partner, and the whole team here at CHEO for hosting us today. We're very grateful for having us by. Friends, when it comes to your health care, your child's health, nothing is more important. That's why earlier this year we introduced Your Health, a plan to connect you to convenient care, all while using your OHIP card, never ever your credit card. Our goal is simple. Whether it's an emergency in the middle of the night or a problem that's been bothering you for years, no matter where you live, we're connecting you to more convenient care closer to home. We're shortening wait times for surgeries and diagnostics. We're expanding access to home care services, community paramedicine, and allowing pharmacists to provide more care at no extra cost. We're making historic investments in healthcare infrastructure, including $50 billion. This number always amazes me. Including $50 billion to support more than 50 new hospital projects right across Ontario. I always say, no matter where you live in Ontario, you're either getting a brand new hospital, you're getting an addition to a hospital, including almost $40 million for early planning to build the Ottawa Hospital's new civic campus, which is going to be the second largest investment in Canadian history. This $50 billion investment, it's the largest investment in healthcare and infrastructure in Canadian history, and will add another 3,000 new hospital beds on top of the thousands we've already added. Here at CHEO, for example, we've doubled the number of critical care beds so our children in need get the intensive care they need. And friends, we're making great progress in hiring and retaining healthcare workers, because there's no healthcare system without the amazing women and men who work on the front lines providing the care. These are some stats for you. Since 2018, when we took office, over 63,000 new nurses and nearly 8,000 new doctors have registered to work in Ontario. Those are amazing numbers. These are the nurses and the doctors we need to staff and work in our hospitals, emergency departments, in family clinics, and community health centers. In fact, last year was a record-breaking year for new nurses in Ontario, with over 15,000 new nurses registered and ready to work, and another 30,000 nurses studying at a college or university, providing a pipeline of talent and reinforcements. When it comes to hiring more nurses and doctors, we aren't stopping there. We want this year to be another record year. It's why we continue to attract highly trained nurses from other countries and other jurisdictions, and are making it easier for them to get to work right here in Ontario. It's why we expanded our popular Learn and Stay grant, which pays the full cost of tuition, books, and supplies for nurses and other in-demand healthcare professions, so long as they agree to work in underserved areas of our province after graduation. And it's why we're funding the largest expansion of medical school spots in over a decade, including right here in Ottawa. But when it comes to your health, when it comes to our children's health, we must do more, and we're doing more. Today, we're pleased to announce that our government is boosting annual funding for pediatric care by $330 million. That is so good. You know, and what is so good, and what is so good about that $330 million? It's not the one-time funding; it's ongoing funding, and we're going to continue to build on that. We know that when your child gets sick, the last thing you want to deal with is a backlog list or a wait list. You want care, and you want it fast. That's why this new investment will be targeted at high-impact initiatives that can be implemented quickly to reduce wait lists for youth and connect more children to the care they need when they need it. These initiatives include hiring more staff to do more surgeries for our children and youth, so we can further reduce wait times, more rapid access clinics to divert children and youth away from busy emergency rooms during flu season, and building 8 more youth wellness hubs, making it easier and faster for young people to access mental health supports right in their community. Yes, that's very good. That's so important. The new funding also includes more services to support children after surgery, to provide a faster and smoother recovery so they can spend more time at home. Friends, when it comes to healthcare, we're making historic investments in new hospital beds, pediatric care, long-term care beds, and mental health and addiction services. We're being bold, we're being innovative, we're working hand in hand with our colleges, our universities, and our healthcare partners. We're connecting more people here in Ottawa and throughout the province to convenient care close to home. I want to thank everyone again for everything that you do in our healthcare sector, and I want to thank you for joining us, and may God bless the people of Ontario. Thank you.
We'll now go on to the questions. If reporters could please line up at the microphone behind me. Please identify yourselves by name and outlet, and we'll try to get to as many of you as possible. Just a reminder, it's one question and one follow-up.
Thank you.
Good morning, Premier. Thank you for taking my questions. Natalie Van Roy from CTV Ottawa.
Yes.
This new funding will include hiring pediatric surgical staff to allow more day surgeries. And we know staffing challenges have led to the closure of emergency rooms across the province and delays in getting timely access to medical care. How many staff are being hired, and where specifically will they be located?
Well, thank you for that question. I think it's a good question for my minister.
Thank you. So there's actually over 100 different proposals and initiatives that are included in this investment, and it really means that no matter where you are in the province of Ontario, if you have a children's treatment facility, if you have a children's hospital that serves your area, then you're likely included in this investment. I want to reinforce that temporary ED closures, while greatly disturbing to a community, are being dealt with very hands-on at the Ministry of Health. We work directly with our hospital partners if they are, for example, having a challenge finding an emergency department physician. We work to connect with Ontario Health and the local hospital. Obviously, we still need to train and recruit more physicians, more clinicians, lab techs in the province of Ontario, and that is not an overnight solution, but we are working in the short term on things like As of Right, which is first in Canada. If you are a clinician who have a up-to-date regulatory college license, you can come to the province of Ontario and start working immediately. This is something that didn't exist 2 months ago. And we're doing this work in Ontario to make sure that if people want to practice in the province of Ontario, they have that opportunity to do so without a lot of red tape. Thank you.
And follow-up question for the Premier. The LRT in Ottawa that costs billions of dollars is grounded once again. There's been ongoing challenges with the system in a public inquiry that took place last year, yet the trains are still not working. Commuters and residents are very frustrated. What's your message to the city and residents in Ottawa about this ongoing problem?
Well, first of all, it's unfortunate. I think the previous administration and the previous mayor are accountable. It was a real disaster, and we're supporting them on funding. They're the ones building it and operating it, and I know phase 2 as well. But I know Mayor Sutcliffe is doing a great job. He's taken the recommendations from the inquiry and he's fixing it. So we're there to help them any way we can. But they're the ones who built the system. That was not a good system that they built. So let's just hope phase 2 gets built properly right from the get-go, because there's a lot of money invested and people want proper transit here in Ottawa.
Thank you.
Thank you.
Thank you.
Thank you so much.
Good morning, Taria Isri, Global News. My question is for Minister Parsa. Your new proposed changes to the child welfare law will prohibit a number of cruel practices, but it's not clear how these laws will actually be enforced. So can you provide some further context?
Yeah, thanks. You're referring to the amendments of 115 and 116. So it is posted for consultation right now and feedback. At its core, for us, it's about strengthening oversight and making sure there's accountability for service providers, all to make sure that children and youth are supported. That is it. And so, as you know, it's right now in the consultation. We will be receiving that feedback and going from there.
Child welfare experts say what's needed is more funding for prevention services and mental health resources to keep these kids out of care in the first place. So what's being done to address the bigger issue?
What I could tell you as Minister of Children and Community Social Services, there's nothing we won't do to protect children and youth in our province. They're 100% of our future, and we'll make sure through investments like this that's being done today, we will be there for our children and youth. And certainly as a minister responsible, protection of our youth, that's why we have the CYFSA review. We want to make sure that the programs that we're offering are strengthened and there's oversight to make sure that kids, every single child is protected, including every single child in care.
Question for the Premier, Ian Bailey from the Globe and Mail. Premier, you've tweeted this morning about Parliament being recalled. Obviously, there's discussion about parliamentary action on the port strike. Where have you heard about Parliament coming back? I guess we've not heard the federal government commit to this. And are you looking for some sort of action in addition to bail on the port strike?
Yeah, well, thank you so much. If they call the legislature back, then yes, I'd like them to add in the bail reform. That's so important. But I just heard right before I walked out here, they might not have to call it back. They might be able to order them back to work without going back to the legislature. But, the port strike, I'm hearing from some of the largest retailers that they're going to be running out of items. And anything that affects the entire country, which the port does, it's not just the Port of Vancouver, it's the Port of Edmonton, it's the Port of Calgary, it's the Port of Toronto. It has many ports. So we need to get the goods to market as quickly as possible. And I just, I always say I always want a fair deal for the workers, fair deal for the taxpayers, and hopefully they can put this to bed today.
Was it the Prime Minister who informed you that Parliament might be back? And as a sort of splitting a question in two, do you see a provincial, on the LRT, do you see a provincial role in getting Ottawa residents, the working LRT, back anytime soon? Yeah,
so thank you for those questions. The first one, no, didn't come PMO. Maybe my office talked to the PMO, but I just heard they may not be calling the legislature back at all. And regarding the LRT, we put a tremendous amount of money into the LRT. We handed it over to the city of Ottawa, and I don't know, it was a mess. That's all I can say. The inquiry, said everything. But we're always there to support the people of Ottawa. We're there to help any way we can. There's a new administration. I think the world of Mayor Sutcliffe, and we're there to support him any way we can. People want transit, and we'll be there to help them.
Hi, Premier. This is Sarah Kester from CBC News.
Hi, Sarah.
If the federal government does legislate the workers back to work in the Port of Vancouver strike, will you support that legislation?
Oh, 100%. That's really up to them. But all the premiers, when we met last week in Manitoba, that's one of the key areas we wanted the feds to focus on, because it really has an effect on the economy and day-to-day goods. But that all goes back to, we should produce as much as we can right here in Canada, right here in Ontario, until we don't have these issues. Or even better, anything that we can't produce here in Canada, we should produce it in the U.S. or Mexico. I always say buy Ontario, and second to that is buy North America.
And you've sort of touched on this, but what kind of impacts are we seeing in Ontario from the port strike right now?
Well, I'll give you an example. One of the big retailers called me, and that's just one item. There's numerous items. Barbecues. They won't be able to get barbecues. Some barbecues parts come from over in China, and all sorts of different items are coming from overseas. And I just told every one of them, well, what can I do to help you to have domestic production here in Ontario or Canada or even North America? But I think they're really waking up to that fact. If people want certainty, are they willing to pay, I don't know, a nickel more? I would. I'd pay more knowing that the products are produced here in Canada and Ontario, and supporting local jobs. It's really important to focus on our local economy.
Thank you. Liz Payne with the Ottawa Citizen. These are questions for Minister Jones.
Yes.
Thank you. Hi, I just wanted to ask again about Health Human Resources. In this plan, there are still shortages. It's very hard to hire enough nurses. Some of these programs in place are longer term. Is that liable to slow down some of these programs for pediatric expansion?
So I've often talked about the short, medium, and long-term goals. Of course, the Learn and Stay program, which is a program highlighted by our colleges and universities, Minister Dunlop, actually allows nurses who are perhaps in their third or fourth year to also apply. So it gives you an example of even nurses who are training still have opportunities. I've spoken to many hospitals who have used the nurse preceptor program as another example. We'll train and we'll continue to make sure that we have sufficient health human resources in the province of Ontario, but we're also doing stuff directly with our regulatory colleges. Another example, with the College of Physicians and Surgeons of Ontario. First time in Canadian history, if you trained in the US, the UK, Ireland, or Australia, you have a faster pathway to be able to train and practice in the province of Ontario. Those are real concrete things that are happening today that are making a difference, so that as we continue to recruit and retain in hospitals, in primary care, in our public health units, there are sufficient people. And I have to say, using the Learn and Stay as one example, the applicants that have applied are well over, they're almost 7,000 now. And that speaks to the interest in people wanting to practice here in Ontario and train in Ontario. And we'll continue to do that work.
Thank you. As a follow-up, you already talked about emergency temporary closures and said that the health ministry people are in touch. Down the road, some children who are patients of this very hospital, in fact, in Carleton Place, that hospital has closed overnight 12 times since the beginning of the year. Its sister hospital has closed 4 times. There's no end in sight, it looks like, for those. So some of those kids cannot get urgent care close to home. Is the ministry doing enough? What more can you do to do something about these closing?
Well, I think today's announcement really speaks to building capacity in community as well as in hospitals. This is a problem that is not going to be solved just by investing in children's hospitals. And of course, CHEO is a beautiful example of that here in the Ottawa region, where family members from Carleton Place would often take their children to CHEO first and foremost. But I want to re-emphasize that the $330 million announcement that we are talking about today is all about building capacity across the entire continuum. So whether your child is having an acute incident and needs that children's hospital, or needs the rehabilitation piece, needs the mental health piece, you know, I'm incredibly proud of the fact that under Premier Ford, since 2018, we've had a 25% increase in investments in children's mental health, including youth wellness centers. Thank you. So there are many pathways for people to access service, which is exactly what families want. Thank you.
Joe Coppolino from QP Briefing. One of these things that isn't addressed is the shortage of family doctors. 2.2 million Ontarians don't have access to primary care. Investment in these services will help maybe the urgent care or the mental health services, as you mentioned. How are you addressing the issue of primary care, where hospitals are being overburdened with things like people coming in for colds, for things that they may be able to go see a family doctor for? So what's the next step going to be to help make sure more people have family doctors?
Well, before I pass it over to the minister, since 2018, we've registered over 8,000 more doctors. We're building new medical schools. More grads and undergrads are going through there, and we aren't going to stop. We're going to continue funding that, and we're going to continue making sure that, as the minister said, qualified people around the world, be it the UK, not only nurses but docs, if they're good in the UK, or if they're good in Nova Scotia, or they're good in BC, they should be able to practice here in Ontario. But I'll pass it over to Minister Jones.
So we have expanded the number of residency spots that are available in our medical schools. In the Ottawa region, for example, 22 new positions that are now there. And we've done that in all medical schools. So we are making sure, and of course the Premier referenced 2 new medical schools in the province of Ontario. 2 that have been, the last time we had medical schools announced was Northern Ontario School of Medicine. So we're making those investments, but we are also working with the College of Physicians and Surgeons. Last August, we directed them and said, anyone who is waiting in the queue for an assessment, I want you to assess and ultimately license, when appropriate, the individuals who want to practice in the province of Ontario. I mentioned earlier the as of right, which really is groundbreaking. You know, I'm having ministers of health from across Canada say, how are you doing it in Ontario, because we want to duplicate it in other Canadian jurisdictions, which is exactly the way to go. We should not put barriers in place for individuals who want to practice in the province of Ontario. And we're doing that with working with the College of Physicians and Surgeons. We're doing that with working with the medical schools, and we'll continue to do that work. Thank you.
The next question would be, how are you incentivizing workers to actually join the workforce when one of the main sticking issues is how much they're getting paid? And while this funding may be able to make more job opportunities, how are you incentivizing them to come join the workforce if they're being paid less than they expect to be paid?
Well, in fact, I would suggest to you that as you look at the numbers of individuals who, for example, have applied for the Learn and Stay program, it speaks to people's desires to want to work in the province of Ontario. Look, I don't want to put barriers for people who want to practice in the province of Ontario to do that. That is why the focus has been very clearly on how do we build the workforce in the long term, and how do we today, right now, make sure that individuals who want to practice in Ontario have that opportunity. I think it is lost on some people that, you know, if you are a nurse who is practicing in British Columbia, it could take you up to a year to get the license to move and practice in the province of Ontario. It's not right, and it needs to be fixed. And that's why we are working with the regulatory colleges to make sure that they have those faster pathways in. We would embrace and want to have clinicians working in the province of Ontario, and we are seeing that with the initiatives that we have put in place, many of which were frankly ideas that came from listening to individuals in the health human area, we're moving the dial and we're making a difference to make sure that they have those opportunities here in the province of Ontario.
Bonjour, Julien Paquette avec Le Droit. Question would be for Mr. Munter, actually, if possible. Est-ce qu'en français ça va?
Oui, sûrement.
Pour garder votre analogie de la boîte, cet investissement-là, de quelle façon, un peu plus concrètement, ça va permettre au CHIO d'améliorer ses services et de...
Bien, à travers tous les aspects cliniques, et on va pouvoir vous donner plus de détails tantôt. On n'a pas encore eu les détails pour le CHIO en particulier. Cette annonce sera partagée parmi les hôpitaux pour enfants, les centres de traitement pour enfants et aussi les centres des agences de santé mentale. Mais je dirais que nous prévoyons entre 200 et 250 postes de plus, donc de médecins, infirmières, essentiellement toutes les disciplines. On a des équipes qui travaillent en ce moment pour augmenter notre capacité. Donc, notre but, c'est de pouvoir livrer plus de chirurgie, de rendez-vous en clinique, de travailler avec les médecins de famille et les pédiatres de la communauté pour créer de la capacité afin que les enfants ne sont pas obligés d'aller au CHIO pour obtenir les soins. Donc, stay tuned. On aura beaucoup d'annonces cet automne en termes de l'expansion et ce que ça va vouloir dire pour les familles.
Est-ce qu'il y a aussi des plans pour des travaux d'infrastructure liés avec ces fonds supplémentaires?
Oui, on va redévelopper le site ici. Donc, il y a un centre de traitement pour enfants, donc les enfants ayant des besoins spéciaux et les enfants qui font face à des défis de santé mentale. Donc, c'est de 6 étages. Ça s'appelle un lieu pour aller mieux. Donc, encore une fois, plus de détails cet automne en termes du progrès de ce projet-là. Et notre fondation va dévoiler une campagne pour moderniser la facilité ici pour élargir les espaces cliniques ici au CHIO. Donc, c'est un moment vraiment pour nous plein de joie, plein d'attente et plein de travail.
And this will be the last reporter.
Bonjour, Chandalia Louis de Radio-Canada. Première question, c'est pour Monsieur Alex Munter. Juste en français. Donc, je sais qu'il y a eu plusieurs situations ici, même au CHIO, où est-ce qu'il y a eu des débordements pendant les dernières années. Justement, c'est quoi la situation en ce moment? Qu'est-ce qui se passe en ce moment dans l'hôpital?
Ben, en ce moment, évidemment, c'est occupé. Il y a beaucoup qui se passe, mais ça va mieux. Et le but, évidemment, de l'investissement dont on parle aujourd'hui, c'est d'éviter le genre de débordement qu'on a vu l'année dernière, ici au CHIO, mais vraiment à travers le monde, dans les centres pédiatriques.
Can we ask a question in French for Mr. Ford? It doesn't feel okay, no problem. So the 330 millions, it's an ongoing funding, you said. Is there any time frame to achieve some important goals? For example, you talk about hiring more nurses. Is there a time frame for that? Is there...
Well, we're the minister, and I'll hand it over to the minister in a minute, but any funding that we send over right across any sector, we work hand in hand with our great partners, be it at CHIO or at Sick Kids or any other area that's receiving the funding, and we look at where the need is, and where the need is, that's where the money's going to go. But I'll pass this over to Minister of Health.
Yeah, so the funding letters are actually being prepared right now, and many of them are based on proposals that have come forward by the individual organizations. So some will be very short-term, immediate type goals that they want to, for example, prepare for fall flu season, and some are longer term that have an innovation piece that will take longer to roll out. But again, I want to reinforce what the Premier mentioned, which is this is ongoing commitment. This is not a one and done. We understand that we're making an investment in the sector to make sure that it is prepared for any challenges that we have going forward. Thank you.
Great. Thank you, everyone.